trends together. So this is the induction. It's coming from a friend in Germany called 𝐼𝐿. He's the father of dental hypnosis in Germany. So I use a light. Okay, I'll make the demo for you. And it's very simple induction. The patients just follow the light. It's very gentle and elegant induction. Once you get that, you make a 𝐥'𝐈𝐌𝐃𝐇𝐀-𝐈𝐌𝐾𝐂𝐄𝐓 of the hand. But in fact, you can invent and create any kind of induction you want, and you understood how the hypnotic phenomena are working. It's trying to bend, and then I still tell me that there's something with it, there's a skull on the arm, so I have to be careful. Then I make distraction filter. I say you will hear everything, the music, the patient, the telephone, stuff like this, you know. And everything you hear about you bring you deeper in that state of relaxation. I have a mirror. So usually I'm watching from behind, but also in the mirror, all the sign of trance of my patients. It can be deglutition, eye movement, it can be breathing, it can be general tonus, muscular activity, stuff like this. And then I try to make deepening technique and then create the hypno anesthesia. How do I make it? I don't know, because oh yeah. So I say, on this part of the jaw that I touch, the more pressure you will have, the more insensitivity you will have. It's completely illogical. But once the brain accepts it, and I test it, it's done. And you get it like this, you know. Hypno anesthesia is incredible when you get it because it's very fast. So this, it was dental extraction. This patient was selected, you know. What I mean is that if I want to make it on everyone, sometimes it couldn't be possible because most of my patients, I would say 80% say, okay, you make me, treat me under hypnosis because it's such a good state of relaxation, but I want chemical anesthesia, you know, because I'm afraid to feel pain. And that's a good mindset. So usually, when a patient is, I would say, a virtuose, like 20%, I don't do better than my colleague. We usually have 20% for hypno anesthesia, 20% of the patient. And it's patients that are motivated, trained, but basically they are very good subjects. What I mean is that from the beginning, they have a hypnotizability level, which is very good. And we know more about hypnotizability now, about genetic factors, about psychological environments, many things that can influence the... And so this one is a young guy, he is a player. What I mean, say, okay, yeah, I can make it, I can make it. But sometimes it's the contrary. I see the patient and I feel, oh, he's very good in hypnosis. Because I am sure I can make hypno anesthesia. I say, oh, give me a chemical anesthesia. And sometimes I make a placebo anesthesia. I put the needle, I don't inject anything. And the patient say, oh, the jaw is completely numb. I say, yeah. Don't tell it. So we have different tests, but it's very subjective, you know. It's as Hellman and Esdaile, they describe this test to have hypno anesthesia. And some patients have the 4 tests, some patients can have 1, but you don't have to bother a lot. Basically, when we go to that state of very deep relaxation, we have a spontaneous analgesia, which means you put a clamp on the patient, doesn't feel anything. But it's not anesthesia, and there's a difference between two. You have a catalepsia of the major and minor muscles. You say to the patient, try to move your arm, you can't move it. And we have a catatonia. It's very, I don't know if anyone uses Esdaile state, but when we move the patient, it's different from a catalepsia. It's more waxy. We can put it in different position, and it stays like this. It was described by Esdaile. Something very interesting, which comes from Hellman, but